Welcome back to East Texas Live on KETK. Many Americans do not get enough sleep, which can interfere with your health.
And joining us to talk more sleep and a new product to help is Dr. Michael Lewis with Ear, Nose, and Throat Associates of East Texas. Welcome to the living room.
Good morning. Thanks for having me.
We're happy to have you.
Yes. How does not getting enough sleep affect your overall health?
That's a good question. It can affect your quality of life, specifically your ability, your cognitive, you can have cognitive deficits, memory loss, job performance. You can fall asleep at work. It can be a problem is in regard to safety if you're, let's say, a truck driver.
Definitely.
And then long-term sleep problems can affect your health. You can be at increased risk for developing diabetes, having a heart attack, stroke, and even sudden death if you are diagnosed with what's called obstructive sleep apnea.
Right.
And I even noticed that in myself, you know, when you go days without having a normal sleep pattern, you just become more irritable, and it's a lot harder to get through the day, you know?
It is.
But you specialize in sleep apnea, and you are now currently implanting a new device called Inspire that could help people sleep better. Could you tell us a little bit about that?
Sure. So obstructive sleep apnea occurs at night during sleep. Some people aren't even aware of it. Probably 80% of Americans go undiagnosed. But it basically, the airway collapses, oxygen drops, and people have frequent arousal. So a spouse may say, my husband stops breathing
in the middle of the night.
In the middle of the night, and they get concerned, and then it's associated with loud snoring. Traditionally, or historically over the last 20 years, surgery has involved actually removing tissue so that the airway doesn't collapse. This new procedure is called Inspire. It's a fully implantable device, almost like a pacemaker. And what happens is it's got a sensor that detects the breathing. When you breathe in, it actually stimulates the muscles in the throat to stay open so they don't collapse. And it's performed as an outpatient procedure.
So people that snore could be a good candidate for this, or who else could be a good candidate for Inspire?
Potentially. If you are a snorer, feel like you don't get a restful night's sleep, if you're tired during the day, or have any of those symptoms we talked about, the first step is to get a sleep study. Inspire is really for those people that have sleep apnea but have failed the main treatment, which is called CPAP. CPAP is continuous positive airway pressure. It's a mask that people wear at night, and this procedure is really targeted for those folks.
And could you tell us where our viewers could find more information about this study that you're doing?
Sure. The procedure is called Inspire. You can go online. Inspire has a website. It was just their results were just published in the New England Journal of Medicine last January. You can go to ETMC's website or Ear, Nose, and Throat Associates of East Texas. We also have some information on it.
Great, thank you.
Thank
Dr.
you so
Lewis,
much for being here.
Thank you very much.